Loma Linda, California, was home to the venomous residents of an ancient desert world. It faced a new challenge as the human population expanded the edges of Greater LA. Sean Bush's team was on alert, improvising responses to an enemy that defied the logic of science. They had to learn as they went. No textbooks could prepare them for life on the front lines, the home of the Venom ER.
Indeed, as the weather warmed above 70 degrees, the snake season began, and Memorial Day, the first big holiday of the season, brought people into their territory. The air ambulance team was ready. In snake territory, respect and common sense were key to survival. But most people were simply having fun in the wild or the water, and the Venom team feared the worst. Greg Dyer and his crew were on duty. It was a poignant time for flight nurse Dee Velez.
The Venom ER was gearing up. One duty doctor was Rob Steele. San Bernardino County had a hot desert, forested mountains, and cool lakes. These were a real holiday draw, but they were also snake territory. Many people were fascinated by snakes. Young kids were drawn to their slithery movements, and older kids were intrigued by their power, speed, and danger. But this was a long way from medical care. Here, a bite meant a frantic mountain drive in search of help, crying out to the forest rangers for first aid, calling an ambulance from the nearest town, and with the venom starting its destruction, time was tissue. Alerting the hospital, emergencies didn't stop on a holiday, scrambling a helicopter, paging Dr. Sean Bush, in a race to a hospital and its high-tech ER. That was how 14-year-old Chris Pattis arrived. He was in the thick of the action in the pediatric ER. Sean Bush and Dr. Debbie Washaki took on the case. It was a tiny injection, but the venom had already hit the muscles in his finger.
The local swelling showed the progress of the venom in Chris's body. His muscles were contracting uncontrollably. Sean could tell from the symptoms what kind of snake was involved. The Southern Pacific species concerned him most. Even a small one was a dangerous animal to encounter. Chris had broken Sean's first law: respect the snake, never pick it up. He would need fluids to support his circulation, counteract the swelling, and keep his kidneys working. An hour later, Chris's airways, chest, and lungs were checked. The treatment needed to be intensified.
His parents were due to arrive soon, and the team would monitor the battle between the venom and the antivenin. Chris was in the pediatric area, but he was old enough to know that picking up a rattlesnake was not a smart idea. His mother, Angelica, arrived and did what mothers do. She scolded him for picking it up, exclaiming that he should have known better. Chris tried to explain, but his mother remained exasperated, reminding him of the numerous warnings about the dangers of handling snakes.
It had been a lucky escape. Angelica's relief was tinged with anxiety. She expressed that Chris had been warned plenty of times not to play with objects he was unfamiliar with, including snakes, but she was just glad he was okay, and that the situation wasn't that bad. Kids like Chris were drawn to mystery and danger, and the allure of snakes was irresistible. Angelica hoped he had learnt his lesson. That lesson would include a night in the ER, but he wouldn't be alone. His mother had no plans of leaving him that night, because he was her baby. He was one lucky kid.
The maintenance dose of Crofab antivenin worked through the night, and Chris created only minor worries for the night shift nurse, Gigi Rodriguez. Gigi explained that Chris had been wonderful. His swelling had gone down, he was moving his finger, he had no problems at all, and he had been eating like crazy. She added that she had been there when Chris was eating Cheetos and his gums and mouth had turned red from them.
When Sean greeted Chris and shook his hand, he inquired about Chris's condition, to which Chris responded enthusiastically. Sean then examined him, noting some improvement, and presented him with a Snake Bite Survivor t-shirt as a reminder that snakes were dangerous. Chris reflected on how his friends had warned him not to pick up the snake, and admitted he felt foolish for not listening. The t-shirt would serve as a reminder of how lucky he had been and the value of respect.
As Chris returned to being a teenager, the pagers went off again as an ambulance brought in Christine Guillaume, another victim of a Southern Pacific rattlesnake. It was a team effort, with Sean joined by Chief Resident Kelly Wesker. On a busy weekend like this, hundreds of ER staff members could be involved, but Sean Bush was in the middle of it all.
There was a concern. Earlier in the season, a leg bite had led to the first fatal case of the year. Sean intended to keep a close eye on any developments. Christine's case was difficult with a strange twist. She had been bitten by a Southern Pacific rattlesnake, and her leg was swollen. Sean needed to track the venom's progression. Christine was responding well, but she had a history of allergies and respiratory problems, making her body's reaction to the venom potentially more dangerous than the tissue damage. In addition to the local swelling, the venom could affect nerves throughout the body. 12 minutes later, the asthma attack they had been expecting arrived, and Christine needed help with her breathing. Sean explained that the asthma attack could be due to stress associated with the snake bite or a mild adverse reaction to the antivenin. However, since she wasn't showing any other signs of an allergic reaction, he believed it was probably just stress. Being bitten by an animal, especially a venomous one, was a real shock, releasing hormones that could complicate the reaction to the venom. Snake bite cases were never simple.
Little was known about Southern California's rattlesnakes, so another team member, Mike Cadwell, was studying the Mojave rattlesnake, the most infamous of all the species. It lived out in the high desert, but people were suddenly there too. As the sun set, the desert cooled, and the snakes emerged to hunt. Mike aimed to catch one, but in the dark, they were nearly invisible, requiring him to be very cautious.
In the dark, a rattlesnake could sense body heat and human scent. Mike relied on his eyesight, but it was backed up by 40 years of experience and knowledge. He explained that they needed to look everywhere, particularly at the base of the bushes. He soon spotted a snake and commented that it was a nice adult, unsure if he had encountered it before or if it was new. To identify it, he needed to check its rattle for paint. Mike then prepared to illuminate the situation, bent down, removed a bag, and put on a torch. Mike marked every snake he collected with harmless acrylic paint, and this snake's rattle was clean, indicating a first encounter. He prepared to pick up the snake with a snake hook, aiming to place it in the bag without too much trouble. From just 3 feet away, he assessed the snake's temperament, noting its typical behavior of trying to get away without being aggressive or very defensive.
Bagging a snake required Mike's unique experience, and it was tricky even for an expert. He mentioned that the bags were easy and lightweight to carry around, but that snakes could bite through them. Carefully, he placed the bagged snake inside another bag on his belly, successfully completing the mission. In the ER, Christine had also had a good night. Sean inquired about her patients and how her wounds looked. Christine responded that they were wonderful, if one could say that about such a thing. Sean pointed out the swollen and bruised areas on Christine's leg, noting the significant swelling and marks. He explained that he had a written discharge and process for her to follow, reassuring her that she was good to go but wanted to go over everything in detail and see her again in a few days. Christine asked what would happen if she were bitten a second time. Sean explained that they could still treat her, but she was not immune.
A second bite could result in the same or worse reaction, and treatment with antivenin would still be necessary, with the doctors needing to know about the previous antivenin treatment due to the risk of allergic reactions. He advised her to avoid being bitten again. Christine thanked him. Sean was scheduled for surgery on a very special patient, the male Mojave rattlesnake Mike had caught the previous night. The snake was under anesthetic and ready to be fitted with a tiny radio transmitter. This transmitter would provide Mike with vital information about the snake's behavior, and it was crucial that it did not hinder the snake or alter its behavior. It was a delicate and painstaking procedure that tested the skills of both men. They wondered whether this snake would survive and return to the wild. Mike Cadwell had explained that they would insert a catheter into the end of the snake's trachea and give it a little cheek puff until its ribs rose, which would evacuate the inhalation anesthetic that had been administered. Anesthesia had been a precise art, making this a tense moment.
Dr. Bush had noted that the snake's chest was rising, a good sign. Mike had then tested the transmitter, which emitted a beeping sound, indicating it was functioning properly. He had concluded that they would finish the procedure by injecting non-toxic paint into the snake's rattle, which served as a color code to identify this individual male. Even a chance of visual contact would become part of the record, contributing to a growing understanding of the snakes. This particular snake was now ready to return to the wild as a dangerous predator.
It had been Memorial Day weekend, the first significant holiday of the summer, providing a chance for people to get out and celebrate or simply remember. The crews of Mercy Air had been on standby, awaiting any calls that would send the helicopters into action. Steve Ellis had unexpectedly received a call about a spider bite.
The case involved a victim who was 31 weeks pregnant, requiring the attention of the entire Venom ER team. It had been a 20-minute flight from the base to the first hospital, necessitating a quick turnaround. Hillary Hildbrad had been bitten by a black widow spider at her parents' home in Palm Springs. This had been a very different case for the team. They had been less concerned about treating Hillary, who had been sitting in the helicopter, than the baby inside her. Dr. Bush had explained that while most people survived a black widow envenomation, the baby had been a greater concern due to the risk of miscarriage. Space inside the chopper had been limited, so Hillary's husband, Mike, had followed by car. Steve's aim had been to keep Hillary calm as the helicopter sped toward the ER. Hillary had started having contractions, a cause for concern given her early stage of pregnancy at only 31 weeks.
After 35 minutes in the air, the journey had ended, bringing immense relief to Steve. Sean Bush had been waiting on the helipad, ready to begin treating the venom in Hillary's body. Dr. Bush had observed what appeared to be a small fang puncture near the marked circle on Hillary's skin, indicative of the spider bite. The team had been joined by obstetric nurse Sarah Pera, making it a tricky case with no guidance available in textbooks.
Sean had faced the decision of whether to administer antivenin to Hillary and had needed to make this choice clear to her. Dr. Bush had clarified that a black widow spider bite could be fatal, as could the antivenin. However, the antivenin could also promptly resolve symptoms and protect the baby, though its safety during pregnancy had not been confirmed. He had mentioned that the spider bite itself could potentially lead to preterm labor or other complications. At that moment, he had concluded that Hillary did not need the antivenin but had emphasized its availability. He had advised her to monitor for symptoms such as abdominal cramping, chest pain, back pain, muscle cramping, or uterine contractions and to report them immediately. Dr. Bush had inquired if she felt sweatier than usual, to which Hillary had responded that she did not.
Dr. Bush had explained that since the spider bite, Hillary had experienced a new little twinge on her left side, and the fetal monitor had shown little contractions in her uterus, which had made him quite worried. He had wanted to ensure that the contractions did not progress because if they did, they would have to administer antivenin to prevent her from having the baby prematurely. The team had faced crucial decisions. The black widow spider, captured by Hillary's husband, had been flown in with her to the Venom ER and Sean, with his experience, had been prepared to handle the spider safely. Although the spider had weighed less than 1/30th of an ounce, its venom had concerned the team. The distinctive red hourglass marking of the black widow had been a clear identifier. The team had been inventing a new procedure, and waiting for the venom to progress had made everyone a bit nervous. Sean and Hillary's obstetric nurse, Sarah Pera, had both felt edgy. Sarah had been particularly worried that the contractions had been closer together than anticipated for a 31-week pregnancy, which could lead to future problems, including the potential delivery of a premature baby, something they had wanted to avoid at that point.
Dr. Bush had explained that if Hillary's symptoms had progressed to serious abdominal cramping or increased uterine contractions, they would have seriously considered giving her antivenin. With Hillary's husband now present, more obstetric expertise had been called in. This situation had been a new challenge for everyone, including the parents. Hillary had explained that the bite had initially felt like a mosquito bite but sharper. She had wiped it with her hand and then her husband had noticed the spider. Hillary's husband, Mike, had explained that he had never been up close to a black widow spider before. When he had flicked it out from under the water and cupped it, he had decided to transport it to the hospital so they could identify it. Dr. Bush had emphasized their concern for the baby's well-being. He had stated that they would conduct an ultrasound to check the baby and the placenta, hoping that the venom had not affected the fetus. This had been a first for the maternity team as well, and they had reviewed case histories but had found nothing similar. Damage to the placenta had been their primary concern.
One of the maternity team members had explained to Hillary that they had been worried about the possibility of the placenta developing a clot and starting to detach. The ultrasound images had shown no signs of such issues, and the team member had reassured Hillary that she had looked stable for the moment. They had planned to transfer her to labor and delivery for overnight observation to ensure her continued well-being. Dr. Bush had found the ultrasound results to be at least reassuring because they had shown that the placenta looked intact, with no signs of tearing away from the uterine wall, a condition known as abruptio placenta. The baby had appeared healthy, showing no distress, moving around, and exhibiting a normal heartbeat. This had been very reassuring. Dr. Bush had decided to hold off on administering the antivenin for the moment.
They had planned to keep Hillary overnight for external fetal monitoring to ensure the baby continued to do well. Dr. Bush had stated that if Hillary's condition worsened, he would be notified, and they would reconsider administering the antivenin. The team had managed to see Hillary through her trauma, and she would be kept under observation by specialists in the maternity unit, but the immediate danger had passed. The ER had then returned to its usual operations. Soon, another emergency had arisen. San Bernardino's Air Division had received a call about a snake bite. They could only respond if a doctor was on board, so they had headed to the hospital to pick up Sean, who had just joined their team. It had been a leap into the unknown for him.
As the sheriff's air rescue had been on their way, Sean had needed to be ready to join them. He had raided the ER for drugs and equipment to treat the snake bite in the field for the first time. He had explained that he would be picking up a child with a snake bite in the field. The sheriff's air rescue had wanted to pick him up and take him to the child, so he had grabbed a bag of antivenin and pain medication, preparing for his first case outside the ER. The call had been for a 7-year-old boy in the mountains 20 miles to the north. The sheriff's air rescue ship had been crucial to Sean's mission, as it had allowed him to start the antivenin treatment as soon as possible after the bite. However, there had been a surprise. The patient had not been 7, but 70. The confusion over the radio had given Sean a very different case.
This had not been an easy first case. Donald Fenestra, the patient, had been feeling nauseous even before takeoff. It had been a major setback on Sean's first field mission, presenting a huge challenge for him to handle on his own. With Donald on board, the helicopter had taken off. Sean had had to decide on the treatment. The team had prepared the Crofab antivenin, which would have been hard to administer in the field, but at the very least, it would be ready for use once they reached the ER. As the precious minutes had ticked by, the venom had been progressing in Donald's body. Fortunately, Loma Linda had come into view, and the helicopter had touched down safely at the hospital. Sean's entire team had then swung into action. It had been a successful start for Sean. Air medicine had a long way to go, but he had learned a lot from this experience.
Past treatments had carried significant risks of reactions, but these risks had been much reduced with Crofab antivenin, which would stop the venom progression. Now, Sean had needed to know more about the bite itself and required lab tests to check for venom in Donald's bloodstream. The team was attempting to estimate the snake size based on the spread of its fangs to gauge the severity of the bite. This particular case seemed relatively mild, but Sean had made significant progress in treatment. He reflected on the challenges, explaining that the helicopter had been a very difficult environment for him. He had found it challenging to mix the Crofab antivenin during transport without adequate desk space, and acknowledged that he had not been fully prepared for such a situation. He had not anticipated riding in a helicopter that day. Eventually, Donald's son, Chris, brought in the snake. It was astonishing that a 200-pound man could be hospitalized by something so small, illustrating the potency of rattlesnake venom. Collie Wesker had found it fascinating, noting that she had heard baby snake bites were more dangerous because baby snakes deliver all their venom in a bite, unlike adult snakes, which deliver smaller doses. Sean had clarified that this was a common urban legend, explaining that baby rattlesnakes only deliver about 1 to 3 milligrams of venom, while an adult snake could deliver anywhere from 30 to 300 milligrams.
At this moment, the monitors indicated that Donald was in critical condition, necessitating immediate action and adaptation of the treatment. This unique snakebite case was reaching a critical juncture in the Venom ER. Donald Fenestra was seriously ill, reacting to the antivenin intended to save him. The team had to adjust the treatment on the fly. Such reactions were common with the older antivenin, but this adverse reaction to the Crofab antivenin was a first for Sean and the most concerning of the day. Each snake bite and individual response varied, and something in Donald's body was reacting negatively to the antivenin. The venom had circumvented the treatment, searching for a vulnerability within Donald's body. Although they had halted the Crofab antivenin infusion, the team continued administering other medications. Given Donald's history of heart trouble and diabetes, his case was particularly complex and worrisome for the team.
Once again, Sean found himself creating a new treatment protocol in real time. It was a steep learning curve. He remarked that this had been the most severe adverse reaction he had witnessed with Crofab antivenin. He recalled that with the older antivenin, such reactions had been routine and often more severe. Fortunately, this reaction had been resolved quickly with medication, and Sean determined that it was not worth the risk to restart the antivenin treatment. Even now, antivenins aren't the perfect treatment for a venomous bite. However, in the ER, Donald's reaction was managed immediately. 24 hours later, he was ready to be discharged. Donald expressed his gratitude to Sean, thanking him and the first responders for their care.
Sean's decision not to administer antivenin to Hillary was also validated. 9 weeks later, she gave birth to baby Braden Hildbrad, thanks to the constant inventiveness of the Venom ER team. Reflecting on the experience, Hillary remarked that they were fortunate things didn't worsen. She described the situation as scary and dramatic, noting that throughout the ordeal, she was primarily concerned about the baby and the potential risks of the antivenin. Hillary's husband, Mike, looked back with appreciation for the medical team, acknowledging how they helped and reassured them. He noted that the team was good at keeping them realistic about the situation rather than allowing them to panic. As the baby belched, Hillary added that the baby appreciated the care too. Both mother and father smiled while holding their baby, the screen fading to a close.